Here are 6 changes that you could make during the Medicare annual election period. Click here to learn more. Let's talk about this. The Medicare annual election period, or the AEP, runs from October 15th to December 7th. This is a time period where people already in Medicare can make changes for the next calendar year. So any changes that you make during that time period take effect on January 1st. So let's take a look at the different steps, the different choices you can make during the Medicare AEP. First, I'm going to talk about people that are in original Medicare. In other words, Medicare beneficiaries who have their claims handled by the Centers for Medicare and Medicaid Services. So what can somebody do who's in original Medicare? First, if you have never enrolled in a Medicare Part D prescription drug plan, this is the time to do it. It's possible or it's probable that you will have penalties if you did not take it timely, but know that if you've decided you want that kind of coverage, get it done during this time period and you'll get a January 1 start date. Now, if you are already in a Part D plan, then this is your time of year to review whether or not it is still going to be the right plan for next year. And that's important. There can be a big difference in pricing on your drug costs between plans. The next thing that someone can do who is enrolled in original Medicare is switch from original to Medicare Advantage. So in the world of Medicare Advantage plans, you can have plans that have prescription drug coverage and plans that do not. So if you don't have prescription drug coverage and you enroll into a Medicare Advantage plan that has it, that penalty that I mentioned earlier still will apply. But in the meantime, that's that time where whoever you're working with or whoever's helping you, you supply your drug list and your doctors and you figure out what is going to be a match to your healthcare needs if you want to switch out of original Medicare to Medicare Part C. Now let's talk about Medicare beneficiaries who are enrolled in Medicare Advantage or Medicare Part C. So first, you can switch from one Medicare Advantage plan to another for a January 1 start date. You're going to do that analysis by providing your doctor's names and addresses and your medications to figure out if that plan is going to meet your healthcare needs. You also could leave Medicare Advantage and go to original Medicare. So that would put you back into Medicare Part A and B being handled by the Centers for Medicare and Medicaid Services. But if you're going to do that, then you're going to want to make sure that you look into a Medicare Part D drug plan, a separate standalone plan if you still want that coverage or if you want to get it for the first time. Some Medicare Advantage plans don't have prescription drug coverage built into it. So you can get that D plan. Most people are going to need that plan unless they have coverage some other place. And then the other thing that you need to think about is applying for a Medicare supplement policy, because remember, original Medicare, it's not designed to cover every dollar, so you want to get that Medicare supplement policy. But you need to understand that most states you have to qualify with your health to get a Medicare supplement policy. And if you can't get into one, you have to seriously think if it is smart to leave Medicare Advantage, because you are leaving certain dollar gaps. One of the biggest ones being that 20% of Medicare Part B bills that is uncapped. So take advantage of this time and really figure out if for the next calendar year, if you're situated the way you want to be, or if you are going to make a change.